Key. Hello everyone. Hello friends. We are here tonight with Dr. Sergio Thiesen. As you guys can see, he's in the screen already. And just for you guys to have a brief an idea of Sergio Thiesen, he's a doctor, a cardiologist, and a physicist from Rio de Janeiro, and he has been traveling around the world talking about spiritism in many different countries. I think Sergio was with us 2 or 3 times. Dr. Sergio, how many times were you in Ireland? 2 times, 3 times, I don't remember. How many?
3 times.
3 times, yes. I forgot, sorry. So Dr. Sergio Thiesen knows our group. He was here with us already. So he's going to be giving the speech here for us tonight. But so we are really happy that everyone is here live. So in order to start, we're going to do our initial prayer. And I will leave Dr. Thiesen to be talking tonight. Okay, guys? So Dr. Thiesen, I'm just going to cut you for a second here just to do the initial prayer. And you come back in a second, okay? See you in a second. Okay, guys. Sorry, just technical things. So in order for us to start, friends, we'd like to ask everyone, if you guys feel comfortable, to close your eyes to do our initial prayer. We would like to ask guidance and support tonight from the good spirits who have been supporting the Spiritism in Ireland for the past 10 years. Let's be very thankful for the lives we have, despite all the troubles we are having around the world with COVID-19. But let's not forget that everything shall pass. And as Jesus told us, there is a time for everything. And also there will be a time for joy for us. So once this crisis pass, we hope the world will be better. Let's be thankful for everything that we have, guys. And we hope that once that ends, we can see each other in the Spirit Center and hug each other and talk to each other face to face. Thank God, so be it. Okay, guys. So, Dr. Sergio, would you like to say anything before you start? Should I leave with you straight? What would you like to do?
Well, let's go to begin the study, this lecture. I would like to thank everyone because of this invitation to talk about something related to medicine and spirituality. I live in Rio de Janeiro. I am in Rio now. And this study that I would like to present to you, it's about a very interesting related to everyone. I would like to begin remembering that the spirits, the good spirits, they talk to us about the planet Earth and about our humanity. And it's interesting to know that this is not a common word, neither a common humanity. Good spirits, by very fine mediums, tell to us that the earth, during many and many millenniums from the past to nowadays, we are as a hospital. We are a hospital planet. And because of this idea, we are the sick people in terms not only about many different diagnoses in medicine in terms of physical diseases. We have thousands and thousands of different diagnoses in medicine, from the ancient days to today. And we have a very important challenge too, related to mental illnesses, psychiatry diseases. I am internal medicine practitioner. I am a cardiologist, but in those recent decades, I am a psychiatrist because of my common practice, because I receive in my office and in a hospital when I work uh, many and many different psychiatry patients and problems related or not the physical body different problems too. Do you understand?
Yep.
So we need to consider this because the people, the spirits that comes to live here, the spirits from many different worlds that comes to live here, that reincarnate here, we are sick spiritual people. Uh, we can live our lives, for example, during 80 or 90 years without uh, to have some big problem in physical body or in mental situation. But commonly, we have one idea that all the people, and frequently we have babies, we have little boys or little girls or adolescents or people in adult lives, and independently of the decade of life, it is very common.
Dr.
Uh,
Thiesen, how about we just, I'm going to put you there and you can start. Would that be okay? Then you can explain a bit more.
yeah,
I'm just going to go here on Facebook to open here because there, I think we have a technical issue here. Just give me 1 second. Sorry, guys.
okay.
It's internet. Sometimes it happens. Just give me 1 second. Sorry about that. Oops. Oops. Okay, let's see if it goes here. Okay, I think we have a technical problem here with Facebook because YouTube seems okay. Dr. Thiesen, I'm going to have to stop for 2 seconds.
No
Just going to
problem.
put on hold for 2 seconds just to try to fix this.
I'm just here.
Thank you. Dr. Jason, so we're going to start again. I'm really sorry about this. Technology sometimes fails on us. So please go ahead. I'm going to remove myself from the live. You are on. So please, if you don't mind starting whenever, if you want to start from the beginning again, it's okay. If you want to stop where you were, feel free also. But you are live now.
What
Okay?
do you suggest that I should do?
If you want, you can just start where you left, and we're gonna go from there because it's running okay on YouTube.
Okay.
Okay, thank you
Well,
very much, Doc. I'm gonna be here behind.
okay, thank you. I was trying to tell you that on Earth, our humanity is as composed by a very large um, quantity of people in spiritual terms with very important spiritual problems. The idea is that the earth is as a hospital. We have many and many different hospitals and schools in terms of different planets and humanities, not only in the solar system, but I am referring in terms of the large universe of God, for example. So it's interesting to us to consider this. The idea that the spirits that comes to the earth and reincarnate here, we bring with us internally very important moral disturbances. And because of that moral big problems, we change our perispirit. We change, disturbing our spiritual body because in the past lives on earth and before the first time that we comes here, um, we are doing many and many different uh, actions, choosing to do this or to do that against the divine laws, the divine laws that we learn about in the Spiritist book. And because of that past, the past troubles in our past lives, we, during the many and many different centuries, many and many different millenniums, we are creating to us problems that are being transferred to the perispirit. And when we comes to a new reincarnation program, frequently as a baby or as a child or as a adolescent or adult, we are dealing with different medical problems related to the physical body or specifically related to the brain. And because of that, we have many and many different diagnoses in psychiatry, for example. So when we analyze the spiritual reality on earth, we need to consider that we have many vicious, moral vicious related to ambition, related to materialism, related to the wars, the violent conflicts between different countries and communities and people. Um, And all of this are related to our moral problems. And this is one aspect of our evolution. Those important actions against the divine laws, they change our perispirit. And frequently we have a cancer, um, we have one neurologic degenerative disease, or we can have one acute myocardial infarction because the coronary heart disease. We can need, for example, one surgery of many different situations that when we need the surgery to obtain one amelioration of our medical condition. For example, we have um, depression. Depression in those days, it's the main diagnosis in psychiatry. So we have one pandemic of depression around the world. So depression is health, uh, public, public health problem in all the countries. And this is a big one because it is true that we have a less or a diminution of the neurotransmitters in the brain neurons. And because of less neurotransmitters as dopamine, oxytocin, serotonin, and many others, this is related to depression around the world. So, because of the development of modern psychiatry, we use the antidepressive medications to obtain a better and a higher level of those neurotransmitters in the neuronal synapses. And our patients have one benefit in using those drugs. But this is a medicine very limited because we are caring, we are dealing, we are doing some kind of suppression of clinical manifestation of depressive disease. But this is not a cure. This is one determined level of benefit, so we can use the word cure. But in the future, 1 year after, if the patient asks to me to do that, or I decide to try to suspend the antidepressive medication, all the patients, they will have all the mental disturbances related to the depressive psychiatry disease. Because using antidepressive drugs, this is not to care in a level that can we do one idea of true cure of the process. Because to use drugs, it's only one mechanism to alleviate symptoms, but it's not cure. Why this? Because independently of the lack of neurotransmitters, depressive disease, it's a spiritual disease. Every time. Maybe some problems that are um, related to the depressive disease in this reincarnation. For example, the people that have one death in the family, and we came to analyze all the life, but frequently we do not find nothing that we can relate to the problems of in this medicine, in the medicine that we have today. And we need to be happy because in the past 30 years, we gain in medicine very nice and very important steps of developments and evolution in understanding many things. But we don't know nothing. For example, we know about the neurotransmitters. We can use this, but the changing situation in neurons in the brain of those patients, this is a consequence of the bad actions in ancient and old lives in the past. So the medicine is changing in the direction of one spiritualization of medicine. And spiritism is very, very important to this new model in medicine. When we try to understand, we are dealing with one medicine in a mechanicist paradigm, one Cartesian paradigm. So we needed to change because we are not bodies that we can think about one idea of spirit or soul. We are not bodies, we are spirits, we are souls living in these days again another reincarnation, another important experience to everyone, and we need a body. We take a new body from our parents, but we are not our bodies. So the change that we have here is always related of our old lives. The same I can tell to you as a cardiologist. I use when I have a patient that call me in a phone call because of chest pain. I suggest the visit to an emergency of a good hospital related to this kind of benefit. So I take my car and I visit the patient at a hospital. And I put the patient in the hemodynamics lab to open the coronary artery that is closed because the acute MI. And when I do this, I can save the life of that patient. It's not me. This is a team involved to this fracture. So this is a very nice opportunity to help that patient and save his life or her life. But this is not a profound or inner aspect of cure. Because if I suspend the medication here, again, in coronary heart disease, the patient will be bad, will be worse in this medical condition. If I put one stent, a pharmacological stent, in the coronary obstructed by a cloth, I would tell it to you that in the future, independently of this first approach and benefit, the disease will become worse again. So I need to relate a different idea of the causes of different diagnoses in medicine. And when we care in a spiritual and mediumistic approach, the spiritual environment of that patient, the prognosis, as in depression, the prognosis is better because I will enter in the past, in the problems from past lives related to the clot in the coronary heart disease. And I can help in a different way and level that patient. For example, one other example, when I have a patient with one cancer, and I'm now working in oncology, there's the specialty related to cancers in general mode. I have many and many different cancers in human beings. And in those days, in the recent decades, we can see one very important growing of the number of cases worldwide. And this is one evidence of that, independently of the important acquisition in medical sciences related to care and to better help the patients, we continue to be sick in spiritual terms. And we need to change our model, because in oncology approach, in a different cancer, maybe breast cancer, maybe prostate, maybe liver, maybe gastric cancer, maybe lung cancer, brain cancer, I can and I need to use the surgery to take out that tumor. I use the chemotherapy, the radiotherapy, and immunotherapy. I use all the good arsenal of medical help to that patient. But if the patient, he or she, do not change in the inner world, if we do not care the spiritual environment related to the bad things in the past, today may be one organ related to a tumor. And frequently, 6 years after, or 10 or 15, the same patient may be another cancer, because the cancer always, as in other different diagnoses, they are related to a sick spirit, sick soul. And all the nice approaches developed by the modern medicine, because of the paradigm, because of the model related only in terms of physical body, we cannot help in a profound level of looking for the true cure of the patient. Do you understand? So I would like to use those examples to consider the idea of In medicine, in one new understanding, we have different levels of cure. So we need to use very carefully the word cure and spirit center and medical practice, because when I take out a tumor, this is a level of cure, but it's not the better level to consider cure, because we need to understand our moral and spiritual uh, problems and relate those problems to the different important diagnoses of different medical problems around the world. So, in the future, and because one kind of spiritualization of life, and when we consider the spiritualization of life, we are going to the future looking for another level, looking for the true causes of the medical problems. For example, another example, diabetes or hypertension. These two different diagnoses or medical problems, we have those or these in the millenniums. We know about pancreas, about insulin, about the diet, the different lifestyles. We need to prescribe insulin or hypoglycemiant drugs to control, to do glucoses, sugar, blood control. But this is not cure. You understand? And diabetes is a very important epidemic in the world. And we have very important consequences to the physical body and to the individual life and to the family, because one diabetes with 10 or 30 years of medical evolutions, we can have one chronic renal disease. We can have blindness. We can have cardiovascular disease related to diabetes. So we need to understand that this is an old model that is very present here in this world, but we need to change. We need to understand that the true cause of hypertension or diabetes or cancer or depression, we don't know by the common understanding in this medicine that we have today in the world. So, in terms of different model, we can ask to the idea that we need to study spirituality. We need, and we are doing this in the recent decades as a doctor, as a physician, in terms of to do the correlation between the common medical problems and the soul and the past lives and the troubles that we left without the true care after each one of the old reincarnations. When we arrive in the spiritual reality again after the death, in the after death, we have one time before the next one. And this time may be one time of 2 or 3, 4 decades, but we do not care about the old problems related to the next reincarnations. So we are dealing with the bad actions because we have the cause and effect law, the action and reaction law, the law of the personal responsibility. So this is a consequence of the old lives. So we need to understand this process. We need to understand the idea of one resignation, because the causes are always inside of us in the past, but the past are inside everyone, every time, in an unconscious environment. But this is our soul or spirit. So in the future, when we can change this medicine and we can look for the bad things in the past, we will care of that things. And when we do it, all the things are changing. And I would like to tell you, maybe in another meeting like this, as a spiritist, working in a spiritist society during the last 40 years, in different groups of doctor mediums or mediums doctors. Because as a teacher in medicine in the university during 4 decades, I have many old students of medicine working with me as spiritist mediums. And when we are working to help the different patients from different colleagues, and frequently very severe cases of different diagnoses, we are opening the spiritual reality of each one. And when I do it in a team of doctors, spiritists and mediums doctors, we can observe the causes and we can help the spirits related to each case of severe diagnosis in medicine, in psychiatry and in internal medicine. And when we do this, we can observe a very different prognosis and evolution. And this experience, I am trying to participate of different congress in different medical areas to share with my colleagues from different countries around the world, discussing with them in small or medium or large meetings in different cities and countries in the recent 20 years, sharing with them this kind of experience. In statistical, medical, scientific methodology, in medical science, to discuss with them about this. And this is one example and one natural consequence of working as a spiritist, working with mediums, doctors, and being a professor of medicine. So this is a nice environment to change in some way uh, the the medicine that we have today. For example, when I put in the computer in the best site of medical research in the world, in from the United States of America, when I put, for example, health and spirituality in the same way to look for the abstracts and to the papers and reflecting the research about this frontier, spirituality and health, spirituality and medicine, I have 8,000 of papers, and many of them, because one kind of scrutiny, uh, looking for the good level of research, I have thousands of them. And I like to look for the experiences from the other colleagues. But frequently, they are not spiritists, they are spiritualists. This is similar, but it's different. So I would like to, to share with you about the new model in medicine, one spiritual or spiritualist model that include the spiritist postulates, including obviously reincarnation, immortality, cause and effect law, the influence of the spirits in the common life of the reincarnated people. And we can share everything and use this body of knowledge and ideas to help the people. And when I go to for example, in Lisbon, in August, in the last year, um, we have in Lisbon, August, a World Psychiatry Congress, the third or fourth that I share this experience with the colleagues in psychiatry. So in Lisbon, we have 6,000 psychiatry psychologists from every country. So when I share with them, I could show to that colleagues the experience from the spirit society. I talk with them in poster and in the oral presentation. I talk about including the psychiatry aspect of disease in the patients, about Allan Kardec, about Francisco Cândido Xavier, about spirit centers or societies, about the spiritual environment and spirits related and acting in terms of the brain and mental reality of the patients with autism, depression, bipolar disease, schizophrenia, alcoholism. And this is in the texts of that psychiatry meeting. the best in the world because it was the World Congress of Psychiatry. In Jerusalem, in December, a few months ago, in Jerusalem, we find our colleagues in one specific area, psychiatry and spirituality, with 300 colleagues from the world interested in this frontier between spirituality and psychiatry. Well, the world, independently of bad uh, bad situations and things around all the countries, in those days of a very important challenge to the world in terms of pandemia and new coronavirus or COVID-19, we can see the benefit of the spiritualization of medicine. And I would like to invite you to know about this. We are looking to the future, and I will refer to you the idea that in Brazil and in one or another country that I visited, we can visit a hospital, a public hospital, or a private hospital, and we have groups that work related to the common doctors, doing the passes, doing the prayer, talking to the patient about gratitude, forgiveness, and many aspects of spirituality to the patients, independently of the diagnosis that they have. So we can, in my office, from recent years, I invite my patients to the prayer with me. And this is a changing of mind, a changing of approaching with my patients. And many Brazilian colleagues are doing the same because we now have one better idea that we are not only physical bodies, not only the brain, not only the lungs or the heart. This is clothes. This is uh, something that we don't need to valorize so much. We need to pay attention to the soul. For example, I can have in my office or in my hospital, in the hospital where I used to stay and to work, two different hospitals in Rio de Janeiro. I have, for example, 20 different people with lupus erythematous disease. This is a very important disease. And we can find different cases with different syndromes in lupus disease. And when I compare all of them, they have lupus, but all of them, they are different spirits, different souls, and different patients. I can use the same medications for everyone, but I need to care of them in a spiritual approach and a spiritual understanding of that medical diagnosis and suffering because of lupus. Do you understand? I would like to talk a few minutes about one understanding. We have the physical body, we have the soul. When we are reincarnated, we have the soul, the perispirit, and the physical body. Do you remember the depression and the idea of less neurotransmitters? This is a very objective detection, but this is consequence of bad things in the past lives, in a common understanding. So we can understand, well, the physical body is with one biochemical problem. It's true. But I needed to understand that all of the diseases, all of them, in terms of physical body problems and diagnosis, and all the psychiatry problems are related to our spirit or soul. And in the majority of the cases, in the very high fraction of this, always we find spirits related to the bad situations and uh, living problems in the past lives, and frequently in this life too. So when we care of the spirits, discarnated ones, the benefits of the prognosis is very clear. So in those days, I can tell to you as a law, a medical law, to these days, to the future. All of the problems in medicine are related to the spirits, to the spiritual world. So in the future, we will use the passes, we will use, I am doing this in the recent decades, we have mediumistic groups in the hospital, public or private hospitals. In terms of, we can and we need to find the true causes of the suffering and the symptoms and the signs of disease that we have today in this case. This is one idea, that all the diseases, all the illnesses, in terms of medical and the medicine that observe the physical body problems, and in psychiatry, all of the medical problems comes from the soul or spirits. I would like to point this aspect. This is a law, because in all of the patients, when we open the cases, we find spirits, and we find very trouble problems in the past. Another idea is about the earth. Not only we need to consider that this is a big medical world, this is one hospital, but we have 7.7 billions of incarnate ones in those days on Earth. And we have, in another kind of statistics, we have 12.3 billions of human spirits in the spiritual reality or spiritual realm. So the idea of this is a big hospital, it is not only in terms of the incarnated people. In the other life, in the other side of life, what we have in the most important expression are hospitals and clinics and physical environment to help the discarnated people. I know, for example, one spirit named Euripides Barçanufo. It is very well known in Brazil and in Brazilians spirits around the world. We have the Hope Hospital, Hospital Esperança, in the spiritual covering or sphere of life linked to Minas Gerais in Brazil. This is a hospital, the Hope Hospital, that receive only spiritists that are going to the spiritual world in very disturbed, physically, perispiritic, physically condition and mental, spiritual problems. And they were spiritists in the last reincarnation, before the discarnation, recently or in some old years. So we need to understand in terms of sites or groups of helping people recently arriving in the spiritual world with good spirits, with mentors, with angels, with familiar spirits, trying to help the people that are recently coming again to the spiritual reality. So this is a very interesting aspect, inviting us to a true modification, a true changing our minds in terms of what we are doing on earth. What is the main objective of our lives? In family, in the streets, in the society, in the job, in the work, in each one of our challenges in the recent and in this life. What we are doing here, we need to consider, and we can study this in the Spiritist doctrine, about that the main aspect is to try with our willness, changing our thoughts, our feelings in terms of becoming in very fast possibility in terms of virtues acquisition, solidarity, charity, gratitude, forgiveness, humility. We need to be different people. If we truly want to be different people and human people and souls or spirits to a better and a happy future on earth or outside the world. In the physical life in the future, or independently in the spiritual reality too, because we are the same in both sides of life. So the idea is we need to understand myself. I need to look myself inside and recognize my problems, my soul problems, my moral problems. And I need to care with love of these inner problems. And I needed to change. I needed to look for the good things in terms of virtues in a substitution of my vicious expressions or characteristics of myself. This is a future of the medicine. In the future, and in the future, we have some aspects in these days. We talk to the patients in the office and in the hospital, including in intensive care units, in emergency, about spirituality. When we have the opportunity or the chance, the opportunity, we talk with the patients about different things. We need to care with the better medicine in terms of the very nice development of medicine of those days, but not only this. We need not only to open the coronary artery to a better prognosis in cardiovascular disease, but independently of that heart or independently of that coronary tree, this is a human being, this is a soul, this is a spirit, and this is a new medicine to have this new approach, considering the mind body paradigm and the spiritism that may be one common study of everyone here in this life. We need to study Allan Kardec. We need to study Emmanuel, André Luiz, Humberto de Campos. We need to study different good spirits that are sending to us in the spirits books the messages that we need, the contents of those messages and those books to help us to change everything. And when we change ourselves in the future, this will go doing some kind of spreading of the benefits that the spiritism help us to obtain. So we will have the possibility to help the people around us to change too. As the same, all the people that are changing their minds and their actions and they choosing in this moment and in this life, they will, all of them, they will contribute to everyone, because in the future, this is a world of tests and atonements, tests and expiations, true? But in the future, in the regeneration world, in this world of the earth, it's interesting to consider that the regeneration, it will not come from the heaven. We will need to find it by ourselves in terms of changing our common and inner moral situation to transform the life. And because of the sum of the benefits of everyone, step by step, acquiring a new and a very nice spiritual reality, we are contributing to change the world and to achieve the step or the sphere of life in terms of plenitude, in terms of obtaining the happiness of a new world. And in that future, we will not have so many illnesses, so many diseases and diagnoses. We will be different, but we need to change just now. Well, I am watching the clock. I would like to think about the questions that you could have in this moment of our talk. Well, I'm reading Dirce. I am thrilled to hear a doctor saying that we must see our body, not just the material body. And yes, body, spirit, and perispirit. Congratulations, Dr. Sergio. Thank you for this observation. It's very easy to the spiritist people to understand those new ideas of true life. And so, because we have this treasure in terms of understanding of life, we need to change ourselves first, and we need to help because of fraternity and love to help all the people to this way to a new understanding of the medical problems. Thank you.
Dr. Thiesen, we have one more question here from Jeers. If you don't mind, because we don't have much time, if you don't mind, try to reply to her shortly. That would help us because of the time. But I'm going to put the question here. There we are. So she's asking, can the depressive state in some cases be linked to obsessive symptoms? I guess she says, if so, how do they act in the antidepressant drugs in these cases?
Well, I suppose that I talk about this in the recent minutes, but this is a very important question because in all the cases of a big medical problem, in psychiatry disease and in medicine, a common medicine and internal medicine disease, always maybe heart disease, cancer, maybe degenerative neurologic disease, maybe Alzheimer, maybe congenital neurological or heart disease, infection, tuberculosis, maybe septicemia or sepsis, independently, maybe Chagas disease, maybe different possibilities. Always we have spirits linked to the case. We have in this linking, we have one idea of one obsession, one influence of discarnated people in the incarnated ones. Always do remember, I suppose I do this observation that when we open which kind of case, maybe lupus, maybe chronic renal disease, maybe severe hypertension, maybe severe diabetes, when we open the case, we find spirits. And those spirits, they are our brothers and sisters. They are brothers and sisters related to the past lives of that patient. For example, as in your question, in terms of depression. So when we use antidepressive, we can do something in terms of benefit, but we are not in a inner level of cure. We are caring or treating the consequences in the neurochemical or neurotransmission. If we want to do a very different in a new medicine, we need to care in mediunistic meetings. We need to care with very intense love, caring, receiving those spirits and carrying them with dialogue, with fraternal dialogue, to help them to send after being with us to a good sphere of life, uh, detached of the case of the patient with, for example, as in your question, depressive disease. When we do this, we are doing a very nice medicine because we are using a spiritual medication to the patient, incarnated ones. But we are carrying the spirits, and maybe 100 of them, in one case of depression. Do you understand? And when we care of all of them, and we can do it in this mediumistic meetings, in one day in Dublin, we can work together. We can do some kind of seminar of mediumistic
Yep.
meetings to care of the patients. I am doing this one in 30 different countries in the last 20 years.
Yeah,
So,
perhaps next time we can do it here in Dublin.
yeah, after
Yeah.
the pandemic, when I have a flight to do that, to visit you.
Yeah,
But
once we can leave home, we can do it.
I can stay 3 or 4 days in Dublin, doing something more than simple lectures or conferences, because we need to be together. We can do some kind of seminar, and we can do some kind of practice, uh, because it is important to see how to do it in the practice, because theory is marvelous, but we need to put the theoretical ideas in practice to help the people.
That's good.
Uh, this is the idea. So, do you remember, if I take out the antidepressive disease medications, the symptoms and the clinical manifestations, they will come back always, because drugs do not care spirits. Do you understand?
Yep. Dr. Jason, we are really thankful for that. I would like to talk even more, but just because of we have the time strength here. So I would like to thank everyone who was here with us tonight. Thank Dr. Jason in Rio de Janeiro, enjoying the nice weather. In Dublin is nice today, but normally we have a lot of rain. So I think you brought to us the sunshine today. Thanks for that. So we're gonna finish with our final prayer. We're gonna ask you if you don't mind doing the final prayer, and after that, we're gonna end the live. But thanks very much, Dr. Thiessen. And if you have more questions, we're gonna send to you over the week. If anyone asks any more questions to us, but thanks for that tonight. Okay, so I'm
Okay.
gonna put you there just for to the final prayer. I'm gonna take myself off. Okay, guys, thanks very much. Let me hit remove.
Well, my friends and my colleagues, I would like to thank you, everyone, to this opportunity to share some ideas about this frontier between spirituality and medicine. Uh, we would like everyone to our God, our Father, the creator of life and the universe, We would like to thank you so much to Jesus, Jesus of Nazareth, the doctor of everyone on earth. We would like to thank you, all the good spirits related to everyone in this group, the good spirits related to Brazil and Ireland, because we are sisters, we are brothers, we are the same family, and all that we want to us individually, we would like to spread as a feeling of love to all of the people of these two very nice countries. We would like to be grateful to the spirits related to Spiritist doctrine, to Allan Kardec, to the good spirits during the codification. And we would like to the spirits, discarnated ones, of our spiritual family. And we would like to be very fine in this moment. We would like to um, desire to everyone in Ireland and that you have in Dublin a very nice night. And remember you and remember me that before we goes to the bed, we do a prayer to the people that are sick, that are with very, very different suffering around the world, because we have some little light. We have a little capacity to love all of them. And we would like to invite the good spirits and the spirits of the nice spheres of life on earth to be with all the people in hospitals, in all the cities, because not only suffering of the pandemia, but everyone, because this is a very big hospital in the universe. Thank you for everyone, and God bless you and God me. And I would like to tell to you that if possible in the future, we can share again. Thank you so much and have a very, very nice night. Thank you.
Thank you, Dr. Thiesen. We left here the link of the Facebook group that you have, Prece pela Humanidade, Pray for Humanity. So we have this, you do the prayer every day at 9 p.m. So we left the group there. If anyone wants to join the group, please go on Facebook with this link. Again, thanks, Dr. Thiesen. We're gonna close here the live, but Stephen will talk to you offline. So thank you very much, everyone. Have a good night. See you. Take care. Bye.
Bye bye.
Vai lá. Vai lá, Alberta. Doutor, você tá ouvindo, Doc? Sérgio. Deixa eu ver se o Estevam tá aqui.
Deve estar entrando.
Já tá entrando.